This episode is sponsored by Mia Water. Mia was founded by Robert Goulet, who I interviewed on this podcast, and I really see Robert as one of the pioneers in the field of water and human health. Water, as we all know, is one of the foundational pillars of life, and yet most of what we drink is full of chemicals, it's stagnant, and it's been stripped of its life-giving energy. Robert created a device which actually structures water and gives it a negative charge, which is truly amazing and vital for human health and the health of the planet. All of that can be measured and tested. These devices are small, they're really well built, and they last a lifetime. They are an investment, but in my opinion, I think one of the most worthwhile investments you can make for your own health and the health of your family. I've been fascinated by water for many years. I followed the work of some of the luminaries in the field, like Gerald Pollack and Viktor Schauberger, and I think Robert has really advanced this field a huge step with the invention of these devices and making this life-giving energy, life-giving water energy, more accessible to all. I use Mia Water devices in my own home, so I'm really happy to recommend them and to have them as a sponsor of this podcast. As listeners of the show, receive 10% off all of their products at miawater.com/universe. That's meawater.com/universe, and use the coupon code universe at checkout. This episode of the podcast is being sponsored by my friends over at Real Mushrooms, realmushrooms.com, my friends Jeff and Sky Chilton. I had Jeff on the podcast. He's a really fascinating guy. I was really happy when they offered to be a sponsor. They sell medicinal mushrooms, things like reishi, chaga, cordyceps, turkey tail. I think many people are now familiar with the amazing medicinal qualities of mushrooms. They sell an amazing product. It's 100% organic. It's the actual mushroom, which is unlike a lot of companies that are either not organic, they don't actually use the mushroom, they can have fillers, they're potentially using the mycelium on grain, and that's in the final product. So really high quality product. It's the only product I use. I think they're just doing amazing work. As listeners of the podcast, you can receive 25% off of your first order if you use the discount code UNIVERSE at checkout, and I think you'll be really, really happy with their products. On this episode of the podcast, I sat down with Dr. Jeff McNairy. Dr. Jeff McNairy is a really interesting guy. He is the chief medical coordinator, I believe, at the Rythmia Ayahuasca Healing Center in Costa Rica. Rythmia is one of the, I'd say, leading centers that works with ayahuasca. They're a very well-renowned center. Also, as I think he said at the end, I'm not sure if this will be in, but a bit mysterious. So I knew some about them, but not a lot. I was really happy and curious to have him on to see what he had to say, and I really just respected him as a man, as someone involved in the psychiatric field, in the plant medicine field, in the medical field. I think he's just doing very good work, really speaking from a place of wisdom, just a really amazing life story of helping people, and I think going quite deeply into the human condition. So this was a very fascinating conversation about ayahuasca, about psychology, about the work at Rythmia, about ayahuasca work in general, plant medicines. And as I said, I think he speaks from a place of very deep wisdom. So I think you all will get quite a lot out of this episode. As always, if you're able to support this podcast, that's a really big help. Patreon is a really good option. There'll be a link to that in the show notes. I like websites like that because they work off this idea of reciprocity. So if you feel like you're gaining something from this podcast and it's an amazing way to give back, you also get different things back, things like early access to shows, bonus material, Q&As. As always, thank you so much to the people supporting that way. It really means a lot. And if you're able to support that way, thank you in advance. If you're not, as always, helping with the algorithms is a really big help. So if you're viewing this on YouTube, hitting the subscribe button, turning on the notification bell, liking the videos, may seem like a small thing, but it makes a big difference in getting this out to a bigger audience. And then with the audio versions on Apple Podcast and Spotify, leaving a starred rating and a short review. And then finally, if you're interested in working with myself, you can check out my website at nicotianarustica.org. There'll be a link to that in the show notes. If you're interested in integration work with ayahuasca or plant medicine ceremonies one-on-one, consultations, and plant dietas with myself and my colleague Marav Artsy. We have our upcoming schedule out, working through the medium of tobacco and tree medicines. We have a number of retreats coming up, which are just really beautiful offerings, and you can find all of that on my website. So I think that's it for the intro, and without further ado, here's my conversation with Dr. Jeff McNairy. Running out from the maze, running out of the maze today. Running out from the maze, running out from the maze, running out from the maze today. Running out from the maze, running out from the maze, run out of the maze today. So great. Well, thank you very much for coming on. We were chatting a little before we started. I would imagine some of the people listening to this podcast have heard you. I think certainly a lot of the people have heard of Rythmia. It's a fairly well-renowned center now. Always a big question, but I always think it's interesting when we start just to say a bit about yourself, who you are, your background. Almost always people who find themselves in this line of work have quite an interesting background. So whatever that is, that kind of life's journey that you've been on that's brought you to this point.
Cool. Thank you for having me on the podcast. I'm excited to kind of talk a little bit about what we're doing in Costa Rica, and it's probably wild. It's been a wild ride. So, I started off my career studying medical anthropology, and I was studying Latin American indigenous culture. And then I really liked the field, so I applied for a doctorate, and I got into Berkeley. And I decided that before I would dedicate my life to academia, that I would defer my enrollment for a year and then go to the UCLA Neuropsychiatric Institute, which I'm from Los Angeles. So I just went there and got hired as a research assistant for a medical anthropologist named Dr. Carol Browner, and she's really renowned. Excuse me. And we did a prenatal diagnostic screening sort of research study on first generation Latin American women and their beliefs about reproductive health and genetic testing, all these things. It was really cool. And during that year, I really liked it, but I saw the lifestyle of the academic people I was working with at UCLA kind of wasn't for me. I'm an outdoors guy. I surf my whole life. I like to do martial arts. I like kids. I have 5 kids. Not at that time, I didn't, but I wanted a family. And I saw a lot of the professors I was working with just kind of, that's all they did. They were just totally into it, which is great, but it kind of wasn't my path. So my professor said, why don't you get a master's in public health instead of going to Berkeley for a doctorate? So I said, okay. So I got into the UCLA School of Public Health, and I worked on health policy and program development. So really in the policy field and management of health agencies. And after I got that M.P.H, I went and I worked at the UCLA OBGYN clinics, and I was managing the outpatient clinics. And what I saw there was a lot of interesting medical care, but a lot of the women brought to the table, they had a lot of trauma and sexual trauma, especially women with developmental disabilities were coming in. And there was no paradigm at the clinic to really address their needs. So I saw an opening to kind of look at mental health related to trauma. And that's where I decided I wanted to get a doctorate in psych. But before I did that, I applied to medical school. I wanted to be a doctor. I wanted to deliver babies. And as I got into UCLA med school, but the doctors I was working with told me, if you want to really make an impact, you shouldn't become an OBGYN because we're all trapped in this field. We have a lot of malpractice insurance. It's $500K a year. There's like 1 out of 3 deliveries sue. And they said managed care is starting to dominate. This was in the mid 90s. And managed care is really a problem for us with California. So I really had seen that as well over the years. I was studying, taking the MCAT and doing all my pre-medical sciences at UCLA. And I said, you know what, you're right. I'm not going to do it. And I moved to Hawaii, and I worked, because my wife was from Maui, and I worked with kids, native Hawaiian kids on Oahu that had issues with school or behavior issues, trauma, addiction, lots of different things. I worked for the Department of Health over in Hawaii. And that's where I really got into like care to help people that had been through a lot of trauma. And Native Hawaiians had been through a lot of trauma of just historical stuff. So that's where I said, I'm going to get a doctorate in psych. I moved back to the mainland, got a doctorate, and then I was managing in my postdoc a rehab called Passages Malibu. I was the administrative director while I was getting my postdoc hours at a psych hospital and in a private practice. And in there, that place was really interesting, Passages Malibu. I was high end. I'd never worked in high end care. I'd always been like low income, underserved, people that really need help. That was kind of my thing. So what I noticed at this high end place was there was a lot of different alternative methods to work with people. There was spiritual counseling, there was body work, there was Chinese medicine. There's a lot of cool things that I never had been exposed to at UCLA or in my education. So I saw that there was this sort of other way to look at things that might be a little bit more, let's say maybe spiritual based or emotional based, that were kind of different. And I was intrigued. So in came a guy named Jerry Powell into the rehab. He's from Pennsylvania. High net worth individual, very difficult. He had a really serious addiction to Demerol, which is an injectable opiate, usually for surgery. People don't have that on the outside, but he had run 165 plastic surgery centers, and he just sold them. And so he had all this access to all these meds, and he was addicted to Demerol. And he came in because his life was crumbling, and he was going through a divorce. His kids didn't want to talk to him. He was doing a lot of cocaine, drinking tons of alcohol. He was just a mess, kind of normal for a rehab, right? So he came in, and he was so, I guess, like you could say, aggressive and sort of intimidating, that the treatment team that I assigned him to wasn't interested in working with him. They said, this dude's not ready yet. Like, you should send him home and have him come back down the road. I said, I'm not going to do that because this guy's probably going to die. He's shooting Demerol. He's passing out. It's just not good. So I said, I'm going to work with him myself for the 2 months that he was there. So I became his primary for 60 days. And it was interesting because we really connected, and we sort of like got to do a lot of good work. And by the time he discharged, he wasn't using Demerol anymore. It was over. But he continued using cocaine, continued using alcohol, continued living a crazy lifestyle. And so I put him in my private practice for 5 years, and I was trying all these different methodologies to help him. It wasn't working. He was getting upset. He was still engaging in really crazy, high risk behavior. And then he said, I'm going to commit suicide because I can't do this anymore. And he got really escalated in his behavior. And I said, look, you've been doing so much therapy. Let's take a break. Let's get you with your girlfriend. You guys go on a vacation, go to the Philippines. That's where he wanted to go, and just relax. So he said, okay. So he went over there, tore up his girlfriend's ticket on the way because they got into a fight over a Nathan's hot dog at the LAX. So crazy. And he went by himself, and he was really depressed over there because he was at like a couples retreat by himself. So it's never a good idea. And he put up on Facebook, he says, this place sucks. And it had this beautiful sunset, this beach, and it just wasn't matching like where he was emotionally. We call that his affect was not congruent with his mood. That's what in psychology we'll say that. And so this woman that we did aftercare with at Passages, we would send clients to her. She had a shamanic background that I didn't really know so much, but she was just this person that would coach people after they got out and help them. And she had met Jerry in Malibu. So she reached out to Jerry because she saw the Facebook post, and she said, I know a place where you can go to flip your behavior around. I've seen this before. I know guys just like you. They've changed their life. You got to trust me. You got to go to this place in Costa Rica and work with this shaman. So Jerry was kind of like, whatever, I might as well do it because I got nothing else. I might as well. So he just left the Philippines, went to Costa Rica, and had this amazing experience with Iboga. So that was his first plant medicine, was Iboga. And it was a week-long thing. He did a couple journeys. Then he came back to LA. I didn't know what he had done. I didn't know he was in Costa Rica. I was kind of just thought he was on vacation. And he was this different guy. And I was like, what did you do? Like, what happened? And he told me about his experience. He realized where his trauma came from. He had sexual abuse from his grandfather. and all this stuff that he released. I'm like, what happened, you know? And he told me about the plant medicine and his experience. And I was intrigued, but I was very skeptical because I'd never seen anybody turn around so quickly. And so Jerry wanted me to go down to Costa Rica shortly thereafter and participate in a ceremony with Iboga. And so I did. I was very nervous about it. I never had any psychedelic background. I was skeptical, but I did it. And what happened that night with me, my first night, was life-changing. I had no idea the amount of emotional baggage I was holding on to from my childhood that was dictating sort of my way of coping with the world and coping with my clients that were very high-risk people. So after that week of ceremonies, we had a couple, 2 or 3, Jerry and I said, you know what, we want to have a place that people can come to that's medically safe, medically licensed, reaches people that would never do this like out in the world. Because the place we did it in Costa Rica was a real dive. It was a dirty, dilapidated house with no medical care and just kind of sketchy. And we thought, you know, the shaman was amazing and the medicine was amazing, but the environment was horrible. So we want to have a place that looks clean and is clean and is inviting and has support, but can provide a ceremony basis that's really helpful. So in that process, we started for 2 years kind of figuring out how to do this. This was in 2014. And we shifted from Iboga over to Ayahuasca through our own experiences with plant medicine. It's kind of a long story how that happened, but we saw that Iboga would be hard to administer in a large group setting because it's like a one-on-one shamanic intervention. And maybe 10 people max would be like the most I think you should probably do. And we had a big facility that we had bought that's 100 beds. And so we're like, that's not going to work. So we tried San Pedro, we tried ayahuasca, we tried some other stuff. And we got a download, or what they call in the ayahuasca world is, you know, a consulta, that we should shift into ayahuasca because we're in Latin America, we're not in Africa, and the medicine didn't grow, Iboga didn't grow naturally in Costa Rica. And that was a requirement for the government of licensing. It has to grow naturally here. And again, it's not abundant in Costa Rica, but there's some down in the south center part of the country near Panama. And so that's where we started working with the government, getting medically licensed. They supervise us, and we opened our doors in 2016. And so we've been open for 10 years. And I'm sure we'll talk about, we have a whole week-long program of support and workshops and classes and breath work and all kinds of stuff. And we've had 23,000 people through our doors. So we've had a lot of people, and we collect data, and we've been able to fine-tune the program over time. So that's kind of like the down and quick and dirty about, you know, how I got here.
Yeah, it's an amazing story. I didn't realize all that about you. I guess kind of going back, what can you speak more? Because I think that's a common thread that draws a lot of people to this work is some people who end up doing this work is some interest in healing. Obviously, your background initiated in academia, but I mean, it may be a bit similar to me. There was something about that more academic or intellectual perspective that I found lacking. And not that it's bad. I mean, you know, I think the medical industry has a place. It's helped many thousands, if not millions of people. But there is, I think, something that's lacking or devoid in a more embodied or felt sense, you know, even maybe for lack of better words, a spiritual sense. What was kind of that turmoil in you that kind of led you to walk away from that?
Well, what I was learning in my postdoc is that the board of psychology is very liability prone and liability averse. And so what I was supposed to be doing as a psychologist was covering my butt a lot. That's what I was supposed to do, like not recommend any treatments outside of the paradigm of therapy, not recommend any sort of spiritual stuff that might be resonating for some of my clients. And like, for example, there's a Reiki practitioner in my office in Pasadena, like in the same office space. And I wanted to refer people to this practitioner after my sessions, and it just wasn't allowed because that's not something that was acknowledged as a protocol within the Board of Psychology. So there's just a lot of things like that that were kind of going against my intuition that might be helpful for some people. And also the sort of model to keep people in therapy, and not get them to wrap it up and, have a termination date. And just to kind of ongoing forever therapy. It's kind of like how they do with meds, like the psychotropics, like SSRIs. SSRIs were supposed to be used for 18 months initially and go to therapy and get new tools and then get out of your depression and stop. But we know that's not what happens. It's people just stay on them for years, decades even. And so therapy kind of had that same sort of vibe with it. And I never liked that vibe. I always wanted it to be short-term, super effective, get it done and be finished. And so some people, of course, like therapy. They want to go forever. They like the connection, I guess, to release things. But I was more of like a practical therapist. I wanted to give them tools, help them move on, become empowered. Because in my background with women with sexual trauma, as my first patient population, they feel like they have no empowerment, no assertiveness, because that was taken from them when they had their trauma. So the goal of empowerment was actually really hard to accomplish with traditional talk therapy. So that's a big part of what had me separate out and really get involved in the plant medicine, because I saw it was giving people sovereignty and empowerment and the ability to be assertive and set boundaries. And of course, getting to know themselves, because you can't really do great work unless you really connect with yourself first.
This is kind of a broad question, and it's always hard to speak in such generalities, but how big of a factor do you think there is this worldview of these kind of long-term treatments? I mean, because obviously I think any practitioner would like to see something work in the short term, but it seems like there's, again, broadly speaking, in the Western model, there is this kind of, whether it's a reluctant view or even now just a normalized view, that the treatments are long-term, that there's something almost physiologically incorrect with us, and the only way to remedy that is through some sort of long-term pharmaceutical use. How prevalent do you think that worldview is?
Well, I think it's definitely was the old school way of looking at it. It's shifting a little bit lately, but the analogy I give is kind of like in the addiction world. So I shifted from trauma and still worked with trauma, but went into, of course, addiction at Passages. And so a lot of people believe in therapy that if you have, let's say, 15 years of addiction behavior, that you need to be in treatment for addiction at least 15 years, if not the rest of your life, because you have this flaw that at one moment you could just dive right back into this hopeless place. And so therapy is viewed as like a necessary tool to just have people always be connected to it. And I see that tapering off lately. And I think it's a big part of this psychedelic revolution that's happening with all the psychedelics, because people are going on retreats or they're having these experiences with psilocybin or ayahuasca or wachuma, and they're coming back to their therapist and they're firing them. So they're not continuing because they kind of feel like they don't need to. Now, I wouldn't recommend doing that like right off the bat, obviously, but I think therapists are seeing that they need to like get it together. And we have a lot of therapists that come to Rythmia, like as clients. And I always ask them, like, how are you doing? Like, what's going on? What are your goals? And they say, I need to see what's going on with my clients because they're coming to a place like this or other places. And all of a sudden they've made these huge advances in their care and they don't really need me anymore. And I want to see what's going on. So I do see that that's kind of shifting. And the pharmaceutical industry is always a real tough one because, of the addictive nature of some of those meds, especially benzodiazepines for anxiety. And there's a lot of that stuff that's kind of battling the pharmaceutical industry. So, of course, the for-profit world of pharmaceuticals is definitely an adversary to this sort of empowerment and healing model that we're all trying to work on.
I would imagine you've thought about this, and I'm sure it's difficult to kind of isolate it to one thing. I'm sure it's been more of a gradual process, but do you think that that's simply it, that for-profit model? Because even the word psychiatry, I mean, psyche, if you look at the Greek etymology of that, it means spirit, it means soul. And yet in our modern context, I think very few people, even in that field, incorporate any aspect of spirit or soul. And there was an inherent mind-body, spirit-soul connection to that word. So even the origins of that word, of where we come from, I mean, there was always a spiritual component, a mental, emotional component, a physical component. Have you ever thought about when and how that kind of got removed from how we speak of the psychiatric field?
Yeah, I do look at it, and back again, it kind of goes back to liability, because when psychiatrists and psychologists are working with a client, especially psychiatrists, and they're responsible for their care, inpatient in a psych hospital or medication management that I used to do, is there's certain, excuse me, there's certain side effects that these meds can have. And there's a lot of high risk behavior that can kind of spin out of control. And if the psychiatrists, the mental health professionals aren't following this AMA established protocol for meds and treatment, and the client attempts suicide or has an overdose and there's a lawsuit, that client or that psychiatrist is in court. They're trying to, the judge will say, hey, did you follow the AMA protocol for meds and everything else? And if they didn't, then they're liable. So I believe that is the liability sort of position within the healthcare field for mental health is what shifted it into something not spiritual and not outside the Jungian, sort of outside the body influence of something other than ourselves. And I think the transpersonal psychology field, which is starting to get momentum, is starting to bring us back to that spiritual side. And it's really exciting. I talked with a transpersonal PhD postdoc recently, and they're really into psychedelics, and they're into spiritual connection and all this sort of stuff that we're talking about that is missing. So I do believe it was the liability, sort of fear of being sued or being in trouble because you didn't follow the AMA protocol or the Board of Psychology's sort of recommendations. You know, that's at least in my experience what I saw.
It's interesting. I was recently on a friend of mine's podcast. His name is Joe Tafur. Maybe you've heard of him, Dr. Joe Tafur.
Yeah.
He wrote a good book. But they kind of tagged me in a post, and so when I looked at that, he did another more recent post, and it was really interesting because he's a medical doctor. I forget what his field was. I think it was maybe general medicine, and again I forget the exact university he went to, but it was somewhere in California. Maybe it was Santa Barbara. Mm-hmm. But in this post, he was saying it was kind of, it seemed, he was delightfully confused in a way, because I think when he went there was no talk of this, and he was saying how now he's being invited back and kind of with open arms to speak about this kind of quote unquote psychedelic renaissance. So it does seem there's a big shift in that way. One of I think that's really interesting in your story, and you've used this word trauma a lot, and specifically trauma with sexual trauma amongst the female clients you worked with. Even I think when I started this work, 20 some years ago, that wasn't a word that was very much in our vernacular. Trauma usually was more like a physical trauma, like you got in a car crash and you experienced some sort of trauma. But now it's very much in our vernacular. But it's a word that can mean, I think, so many different things. Can you speak a bit more about that, and maybe also specifically with the sexual abuse? Because I think that's a very, very interesting phenomenon, and I think still something we don't maybe fully grasp. I think Gabor Mate has also spoken about it. I think he said something like he never worked with a single female addict that hadn't experienced sexual abuse. So, just if you could maybe expand upon some, I think that'd be a really interesting subject.
Yeah, I really like Gabor Mate's approach. I had the privilege of sitting in on sessions that he was conducting with clients to kind of observe, and his approach is really good. And I think, what happened with psychology and trauma in the 70s is that it got a bad rap because the therapists were doing regressive hypnotherapy to try to bring trauma forward. And what was happening is untrue memories were being planted unintentionally by the therapist. So someone would come out of therapy and say, my dad sexually abused me, and it wasn't true. It didn't happen. And so there's all this liability there too. And so the field of psychology got away from trauma work and regressive therapy that was involved in that. But lately it's starting to come back because now they're using it they're looking at it differently. So for us, what I explained with trauma, and we have a lot of veterans that come here too, of military, that have recent trauma. But with the women in particular, when they're going through an abusive moment or an era of assault, whether from a domestic partner or a one-off event, what happens during that trauma moment is that the emotions that are present, those get in the way of survival or of a fight or flight response. So I don't want my emotions to be present during the trauma. I want to push those away and behaviorally survive, whether that's kind of go numb, dissociate, or run or fight. And those emotions of fear, anger, confusion, those things get pushed into the amygdala. And the amygdala is where we store, as you know, a lot of our subconscious sort of history and our emotions and things like that. And they get stuck in there. And then the trauma is over, and then we go about our lives. But those unresolved emotions are kind of starting to get restless, and they want to be released, but we don't really know how to do it as people, especially veterans don't know how to do it after war because they've had a lot of emotions pushed in that place too. So what's great about psychedelics is that it connects the amygdala with the prefrontal cortex, and that part of the brain is where our logical, rational self is. And there's a synaptic plasticity moment. I know you've talked about a lot of your podcasts with a lot of experts that connects a really clear pathway neurologically between the amygdala and the prefrontal cortex to have this psychosomatic release. And that's where, like, you'll be in an ayahuasca session, for example, and you'll drink the ayahuasca, and all of a sudden you start to feel really scared or really angry. And then you have a memory surface like, oh yeah, that's right. Like my dad used to hit me really hard, or my uncle used to sexually assault me. I totally forgot about that, or I blocked it. And we don't really, by the way, just as a side note, we don't try to focus on like the memories or the visuals of the person, because like in the 70s, it could be true. It might be symbolic. We don't have a time machine. We can't go back and see, but the emotions that surfaced, that's what we're working with. So the fear, the anxiety, the guilt, the shame, whatever it might be. And that's where the people have their purge. And as you know, purges show up in a lot of different ways. Throwing up, going to the bathroom, yawning, crying, kind of sweating, all these different ways that you're releasing emotion physically. And that's the great part of a somatic experience, is that you get really, for once and for all, get these emotions processed. And in my field, like working in psychology, I had a lot of women with trauma, and it would sometimes take 5 years before I could get them to that place. I remember one client in particular, I thought therapy was going great. And she was an RN, had a lot of trauma. And she told me after about 4.5 years, she says, now I trust you. Now we can go deep into my trauma. I was like, oh my gosh, 4.5 years into it. And then we started to do the work. So the part I love about psychedelics is you can get right to it quickly. However, the risk of that is you got to have integration. You have to have aftercare. If you just open up this Pandora's box with no tools, you're asking for trouble. So, but I think the field of trauma therapy, especially with Gabor Mate kind of leading the charge, has been a really great thing for people to kind of get past what's been holding them back in their life.
Can you speak more about that point? Because I think that's a really important point, and something that has to be dealt with a lot of care and wisdom, which is that idea of events in our past that resurface during a ceremony. And I think there's been periods or places or ways of working that take everything to be literal, and that's certainly a possibility. And if that was a possibility, there's ways that can be worked with that can be very beneficial. But as we know, things like ayahuasca can be highly symbolic, highly metaphorical, and there can be a real danger of taking something literally as well. But I think the way you describe that is very beautiful, because the emotion is always real, whether the event took place or not. As you said, we don't, and maybe we never know. Maybe we will know. That's also possible. But the emotion is real. That can't be fake. So whatever that emotion is emerging is very real, and that can be worked with.
Yeah, absolutely. And I think too, it's like people that have these emotions that are unresolved, it's guiding their life without them really knowing it, and they're in dissociated place. And the part about being dissociated is we all have this capability to be unplugged from our true self, because maybe we're working overtime and we're just trying to make bills, or we do have trauma and we just don't know how to resolve it. So all of this behavior where we're dissociated and unplugged, and there's a continuum of severely dissociated versus sort of minor. Like I'll dissociate and drive to work because I just don't think about it. I'm just there at work. And that's a minor dissociation, where a large one would be someone that's been through trauma that's really severe, and they're sort of in the shell shock sort of space, especially like the veterans. So it is very important to address that stuff,
You mentioned a really interesting thing, this people with developmental disabilities. Could you elaborate on that? I think that's a really interesting field that you focused on.
Yeah. So when I was at UCLA, my job at those clinics was to get us funding, because we had the UCLA Med Center gave us the resident doctors and the nurse practitioners and the facility to do the work, but I had to drum up money to fund the facility. So I noticed in our client population, there was a high number of women that had Down syndrome, that had autism. Excuse me, I got a little cough today. All these different developmental issues. They were coming in with their mom or their sister or their friend and getting a pelvic exam for the first time, or they had just been, which I noticed, sexually assaulted. And it was this horrific situation that my mind was blown. And I started to look at research to see, is this a theme with the developmentally disabled female population? And what I found in the literature was shocking. I found some studies that said 85% of all women, and a lot of studies said 100% of all women that have developmental disabilities are sexually assaulted at least once in their lifetime. So I was blown away by this. And I had been seeing it present itself in the clinic with the women that were coming. So I filled out a grant application to the feds for reproductive health, but targeting women with developmental disabilities in particular. And it was funny because I was just a kid. I was in my mid-20s when I was doing this, and all the kind of like senior tenured people at UCLA were kind of there. Well, yeah, we'll see if you get funded for that, because it was an $8 million grant that I was going for, like a big number, and I got funded. So it was a 3-year, $8 million grant that I got. It was so cool. And what happened was we got this money, and then I had to kind of use it effectively. And we started targeting and doing outreach to places where women with developmental delays were either working or living, or there's community sort of stuff like regional centers where the people can get involved in the community if they have these disabilities. And we started doing sex ed education and boundary stuff. And that's where we really made an impact with this population. And at UCLA, that program is still going on. And that was, oh my gosh, 30 years ago. So very interesting. No one thinks about that. Like the women that have these developmental things are not getting reproductive care. And if they are, it's trauma influenced. So that was a really cool eye opener for me on ways that you can, make an impact that's significant with people that really need it.
Yeah, that's fascinating. You also mentioned this subgroup of the Native Hawaiians, and could you speak a bit more about that? Because I think Hawaii is such an interesting place. I mean, so many people go there, and it's paradise, and And yet, I think if one is open or sensitive enough, there's also a heaviness there. There's which I think comes from that collective trauma. Can you speak a bit about what your experience was, kind of living and what you observed with that?
Yeah. So, a lot of Native Hawaiians, they don't have a high level of self-esteem, because when you traumatize an entire population and you take their land and you imprison Queen Liliuokalani, who was the queen at the time of the takeover, and you go through all these horrific things that the Native Hawaiians have experienced, what happens is you feel that you're unable to control your destiny because you're being colonized, you're being imposed upon. And so there's a self-esteem issue that starts to go down. And it's not only in Native Hawaiians, but any population that has a low self-view or self-image is at high risk for addiction and depression and lots of other things. So what I was seeing with my Native Hawaiian clients, and I would get a kid in high school or middle school usually, and then I would work with them and their family to try to help give them a boost in some tools to kind of be more successful. But what I was noticing is that a lot of these kids and their families had gotten away from their traditional Hawaiian culture. So I looked at a lot of studies as well. I'm always in the literature reading stuff. And I found that if you can give somebody, especially an indigenous person, a sense of self and have them connect to their culture and ground themselves in who they really are, their self-esteem will go up. It was funny because what triggered this little aha moment for me was I watched this movie called Once Were Warriors. And it's about New Zealand Maori population who have all this, it's a wild story. It's some famous actors in there. But one of the high-risk kids in that movie went back to his Maori culture because he was an at-risk youth doing crime and gangbanging and stuff. And he got connected back to his indigenous group, and he became this powerful warrior. And he was doing the haka and learning all the traditional New Zealand Maori stuff. And so that really helped him get out of the high-risk stuff he was involved in. So that was like a trigger for me. I'm like, wait a minute, the literature's showing this. I'm seeing it with my cases. I need to get these kids back into the Hawaiian vibe. Let's study the language. I was a professor of chemistry at Lab High School for the junior class, and I also worked with Kamehameha Schools, which is a Native Hawaiian private school. I worked there as well, and I just said, let's get these kids learning Hawaiian again because it's a lost language. Let's get the kids doing outrigger canoeing. I had done outrigger canoeing since I was a kid. That's a whole nother story. And let's get them in hula. Let's get them in taro patch cultivation. Taro patch cultivation is a very spiritual endeavor of connection between humans and the land. It's really cool. And then lomi. Lomi is a massage of the earth, and again, a grounding practice that people do, the kopunas in Hawaii. So as I started to do this stuff with the kids, and I would have their family members come, the self-esteem and the self-image started to increase. And that's where the behaviors dropped off. The addiction dropped off. The juvie hall stay didn't happen anymore. They would get a job. They would do better in school. And I was really intrigued by this. And all my numbers started to improve like dramatically. And I got noticed by the feds that had funded this program. I was working for the Diamond Head Family Guidance Center in an agency called the Institute for Family Enrichment. And within that, the feds were like, how does this dude having these numbers like escalate so quickly? So they came and they interviewed me, and they interviewed some of my clients. They're like, wow, this is actually working. So they shifted the way the funding was distributed, and I helped them write some of the protocols on connecting these clients back with their true self Hawaiian culture. And so I did my dissertation eventually in my psych doctorate on Native Hawaiian healing practices for addiction and cultural development in adolescence in Hawaii. And so that was a big part of helping people connect with themselves through building self-esteem.
Yeah, it's beautiful. And then the kind of final group that you mentioned that I think is really fascinating too is veterans. And I think there's a lot more awareness now. I mean, I used to know this statistic and I've forgotten it, but it's some crazy number of veterans who come home and commit suicide. I mean, it's heartbreaking to even
22 a day.
Yeah, I mean that's unfathomable. Can you speak a bit about that? Because I think there's this, obviously most people would realize that the war is hell, but I don't think most people really think about what war is, what you have to see, what you have to experience, what you do have to push down. What do you see in veterans, and what are they dealing with when they come home?
So veterans have a mixed bag of a lot of different things happening that we've noticed. So there's a lot of survivor guilt in the veteran population. Maybe a lot of guys in their group were killed in battle and they weren't, and they have this guilt to them when they get home. And as I explained a little bit earlier with the women in sexual trauma, when veterans are in a battle, they've been trained in boot camp. They trained it, and they didn't even know they were being trained in it. They thought boot camp was about skills building and how to shoot the guns and how to hide and fight. And it is that, but it's also how to dissociate during that battle and take orders and behaviorally get the mission accomplished, which is all important, of course. But during that battle, those emotions get blocked and pushed away. And those emotions, I would imagine from talking to the vets, what they've told me, those emotions are fear, and sometimes empathy for the other people that you're shooting at, or confusion, or not being on board with maybe what's happening in the overall big picture of that battle. So there's a lot of different mixed things happening, but those emotions, if they are present, they'll get you killed. So there's no time for that. So you have to push them away. And then what you're supposed to do after you get back to base camp, and it's funny because even the movies are funny. Like I'm from LA, so of course Hollywood's a big thing where I grew up. And in the movies, all the war movies, when the guys go back to base camp, they're playing basketball, they're grilling barbecue, they're drinking beer, right? That is supposed to be the time where you let those emotions out, you get it out, and then you go back to the battle. But that's not what's happening. Guys are not letting those emotions out. They're just hiding them and blocking them more. So they keep doing these battles, going out and having this, and that well of unresolved stuff just keeps growing. Then they get discharged and they're at home and they're in a dissociated state. And that's where its PTS is just rampant. And post-traumatic stress, and the reason the veteran community calls it without the D, the disorder, because they don't believe it's a disorder, it's a condition. And I agree with that. So PTS is something that they're fully dissociated, and that's where the drug and alcohol comes in, because they think, and it's true for like a short term, if they drink or do drugs, they might connect a little and lower their guard and kind of relax. And it does do that for, as we know, a short time, but that's where they're at risk for addiction, because it's not a fix, it's a Band-Aid. And so that's where they continue to have this sort of dissociated place. And the veterans that we work with, they're often, they don't have the tools or even the desire sometimes to go back and unlock that chest of unresolved stuff. So we have to really work with the veterans in a special way to help them feel safe to do this. We have a veterans only week coming up in September 6th, where we have all special ops guys coming with it's called the Coming Home Project. They're the veterans group we're working with. And we're having all vets here, because we usually have vets, every week, 1 or 2, sometimes 3 or 4, but this can be 70, 80 vets all at once. So that's going to be amazing, right? But a little bit, oh my gosh, could be nuts, but it'll be really fun too. But in order to work with those guys, I'm training their whole team here at Rythmia ahead of time to help them understand the way we do things here, to provide a really good safety net for them. And I think the vets in particular, the reason why they're committing suicide 22 a day is because they're just so tired of being dissociated. They feel that they can't connect with their spouses, with their kids. They're definitely not connecting with themselves. So when you're in a hypervigilant position long term, you get flooded with a lot of baggage, and it's just overwhelming, and nothing really works to get them past it that they've tried. And they don't have the culture within the military to be emotional, to be let things out, to cry. That's all viewed as weakness. And it's like that not just with vets, it's like that with law enforcement, it's like that with first responders. I used to work with SWAT in Los Angeles as a therapist, And those guys do not want to go there. They just think it's going to make them weak. And you have to really build rapport with them to help them see that this isn't going to make you weak. It's going to make you actually quite strong. And so the veteran community is a different sort of animal, that we're learning as we go.
You mentioned something really interesting, which is that on the battlefield, you need to suppress those emotions to stay alive, but that the idea is to come back to base camp and express those. Do you have an idea of like what system or what the idea is of how to move those emotions once, in some ideal world of once someone comes back to base camp?
Yeah, I think the format is present, but nobody takes advantage of it. It's just like a debriefing. It's guys will, in law enforcement, if you shoot somebody, then you're required to go to counseling for a couple sessions. So, but those guys are resistant to that therapy. They don't engage in it. So I think military, the same thing. Like if you're involved in a really hardcore battle or you just shot somebody, you're supposed to debrief with it. But those guys are just resistant for that. So what you're supposed to do is like open up and actually process it and maybe cry or maybe get upset or maybe get confused or doubt what's going on in this war. Why am I here? Kind of stuff, and just get it out. And that's the thing that's not taken advantage of in the military, hardly at all. So the framework's there, it's just not being used.
Mm-hmm. Yeah, along those lines, I think I heard you say you practice martial arts. I've done martial arts for a long time. How has that played a role in your life? It's something that in this field, I think for many people, they don't see those two fields going together, and yet I think they're inherently intertwined. But what role has that played in your life?
Well, for me, it's very important, martial arts. And I started years ago with different types of fighting techniques. And right now I'm doing a lot of jiu-jitsu here in Costa Rica. It's a big hub for jiu-jitsu here, which is awesome. And I think what's happening, especially with jiu-jitsu in particular, is you have to flow with what's happening. You can't muscle your way through it. Some guys could, but it's not going to be sustainable. So it's about connecting with the other person in a way to not allow them to get you into a tap out position. But you also have to be very in tune with yourself. And the beauty of jiu-jitsu is that you can slow it down or you can speed it up and you're at the helm. And the whole concept of martial arts with the fist and the hand is like a position that of sort of saluting the sensei. This is softness, but with fight. So it's like those two go together. The restraint and the attack are part of the same system that have to be in balance. And so with a person in life, what I think happens is there's moments of restraint, there's moments of softness, of connection, but there's also moments of assertiveness and boundary holding and sticking up for yourself. And so I believe that martial arts really embodies that, and especially jiu-jitsu. When I was in California, I trained in Muay Thai, boxing, and jiu-jitsu. There is where I started. But all of those things combined are very, very good to help one, I guess, you could say it like just feel empowered, and a lot of these people we work with, they don't feel empowered. They feel that they're lost. And for me, the mindset of martial arts is really key. And the guys that come to Rythmia, or the men and women that have a martial arts background, do very well. We have a lot of people with jiu-jitsu background come here. We have a lot of guys from the UFC that come here, and they really connect with this process deeply. And I think it's because they're already in that mind frame of assertiveness, but also restraint. And that's what I think requires a healthy, effective coping style.
Yeah, I think that's an interesting way of putting it. I think with any of this plant work, there is that duality, there is that balance. I mean, often it was interesting when I was facilitating, there seemed to be what I would loosely call more of maybe this Western worldview of the idea of the medicine or doing it well was completely surrendering to it, which is maybe more of this archetypal feminine aspect or the open hand aspect that you were referring to. But it was very interesting because a lot of, because we worked with the Shipibo Kanibo people, and very often when you spoke with them, like their advice would be something like concentrate or work with your perfume or smoke or sing. You know, very active things. It was about doing. It was about harmonizing, taking, literally sitting up, don't lay down.
Yeah.
Sit up, do your work, meet the medicine.
Yeah.
So it was seemingly a counterposing force, but I think it was a counterposing force to that other force, because there's always balance. But I think what you're speaking of that duality is so important. And martial arts, I think, is a beautiful way of doing that. I've also done a lot of jiu-jitsu, and it's such a beautiful art. My fingers are pretty banged up right now, having to tape them all the time. But
I know how that feels.
Especially as you get older, it doesn't get any easier.
Mm-hmm.
What was that journey for you like of kind of the roots of Rythmia? Like how did that come together? Because it's become a very renowned center. I mean, I forget the exact number, but I think you said like 23,000 people you've now worked with, which is a huge number. Mm-hmm. Even today, there's when I started doing this work, when I started working at the Temple of the Way of Light, I mean, there was a handful of centers in Iquitos, really in the world, and now I have no idea. There must be probably hundreds, but so. It takes, I think, something special for a center to stay open, because as anyone who's done this work knows, the work itself is very difficult. Keeping a center open, managing it, managing people, managing volumes of people,
Yes.
not only working with people's physical health, but their mental, emotional health, their spiritual health, all of the conflict that can come amongst guests, amongst staff, amongst healers. It's an incredibly complex system that's running. So what was that like? Can you kind of walk us through a bit of the journey of how Rythmia started?
Yeah. So, I grew up in a very rough part of Los Angeles, and there was a lot of gangs and a lot of violence and a lot of not being safe out on the street. My family was amazing. My parents were great, but my environment around me was not. And I had this resistance and this barrier between me and the world. And when I was an intern in psychology at this place called the Sexual Recovery Institute, it's in Beverly Hills. It's a really famous place. Dr. Omar Minwala is the psychology supervisor there and the lead. He told me at the end of my year that there was something that I brought into the room with the clients that he didn't think I was aware of, that was putting them on guard and kind of keeping them a little bit distant from me. And I didn't know what he was talking about. And he said, you should look at this in your own therapy to try to figure out what it is you're bringing into the room, because you're not going to be as effective as a therapist if you don't look at what that is. So I kind of just ignored it, and I just didn't really, I'm having success. I don't even know what he's talking about. So I just forgot about it. So then years later, on that first plant medicine journey, I went back to myself as a little boy. And that doesn't always, as you know, happen for people, but sometimes it does, where you kind of do inner child work and you can kind of, remember or at least feel things that were maybe confusing or upsetting at a young age. And so I went to me, and I was about 7, and I saw myself, and I had a conversation with myself, and I said, what is it that I can learn from you? And I just was asking, and there's this little boy, it was me, and I was talking to myself, and I looked up to the little me, looked up and said, I'm scared. And that's all it took for me to realize that I was a scared little boy that had never been resolved within that fear. And that's what I was bringing to the table in a very evolved, different manner. But I was still sort of trying to survive on the street, but I was bringing that into therapy. So that was the buffer that Dr. Minwala saw. So once I cleared that out and became in tune with that part of me and understood it, as opposed to it being a default position for me, that's where I opened up to the process of what this plant medicine world of psychedelics can do. So Jerry had his own sort of breakthroughs with the medicine, and so did I. But we just realized that, the places we had seen, there's exceptions. We didn't go into Peru. We knew about Temple of Way of Light. We knew that was a legitimate, really cool place. There were some others, but we didn't see a place that really had the medical care that we thought was important. And again, me coming from a medical background and Jerry coming from a medical background and as an entrepreneur, the license that we applied for really made us have that safety part. And that's why we have 4 medical doctors, 12 registered nurses. We have paramedics and counselors and all kinds of stuff. And that stuff is intertwined with the shamanic practice. And it is challenging. It's very challenging to run this place. We have 240 staff members, and it's a 12-acre property. There's 65 rooms. It's this big resort that we've converted into a medical center with a clinic, urgent care, Maloka, all the things you need, massage, hydrocolonic cleanse. But that initial journey, the consulta that we had, Jerry and I did, each individually around the same time, was you have to bring this to the world in a way that will reach people that wouldn't otherwise maybe attempt this. Like going into Peru, going to the Sacred Valley is amazing. How beautiful. But I don't know if my mom would do that, to be honest. Like my mom might not go for that adventure in her 70s, but she might come to Rythmia because that's a place where, it's a little bit more Western and she can feel the comforts of what she's used to. But then we intro them into this shamanic indigenous tradition that's really beautiful, as we know. And it's a way to kind of get people to open up their eyes. And so it's a bridge, is the way I look at it, between, the indigenous culture and the beautiful, sacred healing practices that involves. But then the Western technology to a degree that I get to sort of manage in a way that's effective and doesn't throw off the shamanic tradition. So a big part of Rythmia is being able to fill that gap that sometimes occurs in the plant medicine field.
And what was that process like of getting a license? That you worked hand in hand with the Costa Rican government. Like what does that look like? What does that mean? Because I think that's something that's quite unique. And even maybe if you could speak more broadly, like what is the context within Costa Rica? What are the laws? Like how exactly are you operating?
Yeah, so it was interesting because no one had ever applied for a license before us to serve ayahuasca. So my background was in licensing, so I knew how to fill out licensing applications and get it handled. But the Costa Rican Ministry of Health, they didn't have a format for this. Nobody did. So I had to kind of come up with a system and a standard operating procedure that would show the government that what we were doing was medically viable. And within that application, we had to show, it was like 300 pages, and I had to prove through some literature, which there wasn't a lot at that time. There is a lot now, but 10 years ago, 12 years ago, there wasn't a lot of ayahuasca literature showing the medical sort of benefits of it with depression and alcoholism and trauma. There was a few, but now we have so much more, and it's really cool nowadays. But back then, I had to show the government that if people are medically qualified, if they don't have any contraindicated behaviors, such as psychotropic meds that are problematic, or heart conditions that are problematic, or psychological diagnoses like bipolar 1 is an issue, or diabetes type 1 is also an issue. If they don't have these things and they go through a mental status exam and they go through a medical evaluation that's very thorough, then with the support that we provide and with the medical intervention, they can participate in what we call an herbal support therapy. And that was the category that we were able to work with the government on. And anytime you're going to give somebody in Costa Rica a substance to consume or put on their body, whether it's lotion or a soda or a candy bar, it has to be registered with the Ministry of Health. There's a registration process. And so that process is very politically complicated. And so we were able to get registered through a lot of work with our attorneys and working hand in hand with the government to get this substance approved, because there's a loophole in Costa Rica that if an indigenous group has a history of using this plant, then you can partner with that group and you can become aligned and use it in a traditional sacred practice. But it has to be something that, see, like in the United States, the native lands, as we know, are often allowed to have these traditional practices, and it's not illegal per se. The whole country of Costa Rica is viewed as an indigenous land legally by the government. And so anywhere here can be a fair game for people to engage in these traditional practices. And so we were able to kind of break new ground and write out protocols on how this medicine can be used. And the problem was these categories that they had us fit into, because there's a lot of different categories on a license. Like, what are you guys actually doing? Are you doing nursing? Are you doing intervention with medicine? Are you serving people herbal stuff? Smoothies, like, was on the list, different categories. So we had to work with them to almost shape a new category of acceptable intervention, which involved plant-based remedies. And because ayahuasca are these two plants and they're not active outside the body, that you have to consume them with the MAOI to then absorb DMT. That's another part of this, because analog law does not exist in Costa Rica. So analog law does exist in the United States, for example, and that means if I have DMT in my hand, that's still illegal, whether or not I consume it or not. But in Costa Rica, if I have DMT in my hand, that's not an issue, because it's not active doing anything. If I consume it, what does it do inside of me? And it doesn't do anything by itself, because the stomach will digest it. But if I add the MAOI from the vine, that's where it can start to work. And so that's sort of like a glimpse. It's sort of the rationale that we had to work with the government. And it was very sketchy at the beginning. It was not easy. But every 5 years, they relicense us. So we're on our third license right now, and they love us, and they're partners of ours, even though they site visit us unannounced, which is part of any licensing process. And they evaluate our protocols. I had to clinically justify every single class we offer and every single modality. Like, we have a hydrocolonic cleanse that people do. I had to clinically and medically justify why that's beneficial. Yoga, I had to clinically justify that. The curriculum of the workshops, how to set intentions, how to work with the ayahuasca, how to understand the indigenous tradition. All of that stuff had to be clinically explained. And so that was my specialty, and I worked with them on getting that set up. And it was a long process. It took like two years and change to finally have that, in a tangible form. So we hang our license with pride in the front desk. It says, Dr. Jeff McNairy, is responsible for all this craziness. And I'm like, oh man, it's on my shoulders. So I love it though. And that's a big part of my whole future, and my intention is to be able to be an advocate for things that can be done for people that are safe and elective, because this is something that, as you know, calls to people. And I don't think it's for everybody. And I don't think it should be forced on anybody. You really have to have the calling. And I think the way that Rythmia does it calls to some people. And there's other places that are amazing that call to people in a different way. So I do see this as a synergistic sort of movement of all these different places out in the world that are, without maybe knowing it, are all kind of working together.
So ultimately, your license operates under some form of like herbal remedies for the Costa Rican government?
Yes.
Mm-hmm. Yeah, that's fascinating. So what is, being the medical supervisor there, what does the screening process look like for you when someone applies? What are you looking out for? And again, you don't have to divulge anything, because sometimes you may not want to say what you're looking out for, so people don't purposely avoid that. But what just kind of in a general sense, what are you looking out for? What are things that you feel is important in admitting people and potentially declining people? But even when admitting people, like things that are important for you to know so that you can better work with people.
We turn away about 18 to 26 people a day. And those 18 to 26 people that get turned away doesn't mean they can never come. They might be able to come once they become medically qualified. So what our process is, they call our number, our 800 number, or they fill out an online form. And by the way, we also have scholarships that we do. We gave out $1 million in scholarships in the last couple of years. We want everybody to be able to come that wants to, if they're medically sound. So they talk with a sales associate who has a list of things that they go over. So it's about heart health, autoimmune history, if they've been admitted to a psych hospital, and when was that, how long ago, if they had suicidal ideation or attempts. None of those things, by the way, disqualify somebody. It's just that we need to know where they're at. Like if somebody had a suicide attempt 20 years ago and they've now been happy and successful, but they're just kind of dealing with a depression, that's fine, right? So we're looking for people that are like maybe actively suicidal. We want to provide a different safety net for them as opposed to opening them up for more sort of vulnerability. So medication is a big one. Psychotropics, SSRIs, benzos, and also the opiates are an issue. A lot of those things are just 2 weeks off though. And the SSRIs are about 30 days. Some SSRIs are a little bit more powerful. Some of the first generation SSRIs, we need to have a little bit longer. But there's new data coming out that shows that the SSRIs aren't necessarily creating a serotonin syndrome that's a problematic issue with MAOI, because in order to have a serotonin syndrome, you really have to be consuming an MAOI and an SSRI for an extended amount of time. And having a one-off ceremony where that maybe is conflicting is not going to necessarily lead to a full-blown serotonin issue. So you might have the beginning stages of it, which we know how to look for, and then we can just pull back and not have them drink more ayahuasca. So in addition to like the medical side, like the meds and the heart issues, I mentioned earlier, type 1 diabetes is not allowed with ayahuasca. Now, it can be, but it requires a lot of medical supervision. Like we have to be checking the glucose throughout the night. And that's just not practical for like our facility. But if somebody has type 1, they could still, we've had people that we did at the very beginning, because we just had a few guests, we could really focus on them. But because it's so consuming medically, we say you should get a one-on-one treatment for that somewhere that can handle it. So bipolar 1, people are dealing with a manic sort of lifestyle. And the meds they're on help, the mood stabilizers help bring them down into like a more middle ground with not escalating into mania. But when someone drinks ayahuasca that's come off those meds, their risk is very high to have a manic psychosis. So we don't want that to happen. And we've had challenges in that because a lot of people internationally, especially Southeast Asia, they don't view the diagnoses in the same way that we do in the DSM, And so it's a Confucius-based system coming from China or South Korea and people we've worked with. And we'd ask them, do you have, these conditions? And they're like, no, I don't have that. And then they get here and like they do, but they're not in a manic mode. So they seem normal. And then we have them drink ayahuasca and then they spin out the kind of early stages of mania. And then we know how to bring them back down from that. And we just kind of stabilize them. So that's happened a couple times since the beginning of our treatment. But now we don't deal with it so much because the way we ask questions now really gets to the bottom of that, especially if they come from that part of the world. So once they've passed all these sort of medical checklist things, then we refer them to our medical director, Dr. Arturo, who's an MD here. He runs the medical stuff. He's person I work with closely as the chief medical officer. That's my job. So we go over all the meds the person's on. We open up a chart for them. We have a system of HIPAA protected data collection that we use. And we have those guests come and they show up. We do an interview with them, a mental status exam. Mental status exam is just a quick talk to make sure they're oriented to time, space, and themselves. It's very quick and easy. And then we reevaluate their chart. You see, you got off meds 2 months ago. How are you doing with that? We just kind of get into it with them. And we take their vitals. We do a triage. So we have the nurses take all their vitals. We have an EKG here if we need it. We don't really need it too much, but sometimes we'll give people an EKG. And we do IVs if needed too. Sometimes people will get dehydrated with all the purging. It's hot in Costa Rica, so sometimes those are needed. And then they're medically sound, and we let them participate night one, which is Monday. So guests show up on Saturday or Sunday, go through this medical policy and protocols, and then they're able to drink that first night, Monday. And we have 4 ceremonies: Monday, Tuesday, Wednesday, Thursday.
Yeah. And then how does that look once people arrive? What's kind of the daily routine? What are they eating? Or are they doing other classes? What does the ceremonial structure look like?
So once they get off the airplane in Liberia, which is the northern airport, we have a shuttle driver right there, Rythmia shuttle driver, picks them up. They watch a video in the car about how to fill out the paperwork. They do it in the car, or when they get to the reception, they're greeted by our concierge staff. They're given a workbook, which is a schedule for the week, and coconut water, and it's really refreshing, wet, cold towels. And then we take them down to the clinic, and then they go through all that stuff I just mentioned with the medical checks and balances, and then they have their room. And the only difference in price at Rythmia is the type of room you want, because everything's included. All the medicine, all the classes, all the food. So there's a single room or a double or a triple. That's the only price thing. But once they're cleared medically, which most of them always are, excuse me, there's only a few people that when they get here, they can't participate. That's very rare because they've gone through all this stuff. But sometimes people might start something new and not tell us because they didn't think it was a big deal. Like they started taking Ambien to sleep or something because they got off their SSRIs and they felt anxious. So we've been able to control for that a lot on these sort of intake stuff. But most people are totally good to go. They have an orientation that day, a 1-hour class on the weekend to get them acclimated to what's going to happen. Then that first night of Saturday or Sunday, they have breath work. And it's a really powerful breathwork experience. And we've found that breathwork is often just as impactful as ayahuasca, depending on the person. And so that really sets the stage for the week, is having this amazing breathwork class. And then Monday, they go into an early morning 9 a.m. workshop where we explain the history of Rythmia, how we got here, kind of that story I told you about Jerry and I, and then how to work with the medicine in a most effective way, and how to set intentions. And we teach the guests 3 intentions. And the intentions are: show me who I become, merge me back with my soul at all costs, and heal my heart. Those are the 3 intentions that we help people work with, because a lot of people bring their own intentions, which is great. I'm going through a divorce, what do I do? Or I'm at a crossroads with my job, or I have this trauma from my childhood. So there's all these intentions that people have, which is wonderful. But we found that if they follow those 3 that we teach, those intentions that they have will start to fall in line, and they'll get those answered or resolved. And then during the week, Monday, Tuesday, Wednesday, Thursday, like I mentioned, are ayahuasca ceremonies. And then during the day, there's plant integration class. That's where the people come in the afternoon, bring concerns, questions. Maybe they're confused what happened the night before. So we go through that with a teacher that we have, a counselor. And then there's meditation during the day. There's a meditation class, really good class. Every morning there's yoga. And then they have massage. Great massage is amazing. And then they have this hydrocolonic cleanse appointment. They have 2 of them. That's gravity-fed, ozonated water. And it's self-administered. So it's not like somebody's doing this with you. They teach you how to do it. Close the door, it's self-administered. So you have that too, which is a psychosomatic release. And then the food is amazing. So Costa Rica is really known for super organic farm-to-table food. And so we have all these local places we've sourced with amazing vegetables and fruit. And we have some proteins. We have no cow products. We have some fish, a little bit of chicken sometimes. We have vegan options. Everything's gluten-free. And there's just great food. And we have amazing breakfast and amazing lunch. We don't serve dinner unless someone is not drinking medicine that night. So we have like a little bit of a smaller dinner offering for those that aren't maybe skipping a night or something. So Friday, Saturday, Sunday, the ceremonies are over. There's more breath work. Go through a couple more breath work classes in the evening. And people are going to the beach a little bit more at the end of the week. It's nearby here. And really, if they needed any sort of coaching, there's one-on-one coaching during the week if they need it. Make appointments with us, and we process with them. And then we teach them how to use the Aftercare app. So we have an app called Our Life. It's a 13-week integration app. Has group therapy on it, one-on-one coaching. It has guided meditations. Has 13 video modules of me explaining different techniques on how to stay grounded and how to move forward. And we check in with people 6 months after they left, and we have them fill out a survey. And 92% of those people to date report that this is the week that changed their life. So it's just this amazing sort of collection of data we've been able to get. When the guests leave on the weekend, we fill out another survey, and we ask them, did you get your miracle? Now that's a tricky word, and it's a word that can get misunderstood. So the way I look at that, it's part of our branding. Come to Rythmia, get your miracle. So that can be weird for some people to think of, but the way we explain it is if you meet those three intentions, that's your miracle, that you connected back with yourself. You healed what you're working through. You're able to see who you've become, and it's beautiful who you are, and you've healed yourself. And to us, that's a miracle, because when Jerry had that happen for him, when he was first in Costa Rica with that shaman, that was to him a miracle. So we've kind of kept that energy going. It's kind of fun. And people report, right now we have 98.6% within the last 6 months have said they achieved that. So last week we had 100% said it. And the week before that, it was like one person didn't get it. If someone doesn't get it, we call them that next week. How you doing? Did you get home okay? What are you feeling? How's it going? We might ask them to stay an extra week on the house just to see if they can, get it realized. So we really work with people, and we check in with people. About 30% of our guests come back at some point, and often they're coming back to go deeper. I teach a class for alumni, and I give them new intentions. And sometimes they just come back because they want to bring their spouse or their family or their friends. So it's a really great community that we've been able to establish. People get put into a Facebook group, and now it's a WhatsApp group for their week. So they stay in contact with each other. A lot of these people don't come from parts of the world where this is a common way of thinking. Like, I'm from Los Angeles. I lived in Venice Beach when I was at grad school. Oh, that's no problem if you live there, right? But but if you live in, Sandusky, Ohio, it's going to be a little tougher. So it's really great to build this community of support around the world.
It's interesting that this intention of heal my heart. Why do you feel the heart is so important? Because it's not heal my mind or heal my spleen. Like, what is it about the heart that you found is so vital?
Well, a lot of our guests show up very intellectual based, and they're all in their head. They're wrapped up in their mind. They're stressed out. And we find that if you can follow your intuition and drop into your heart, into your gut, that's where the truth lies. That's where your navigation compass is. In Hawaiian culture, to kind of talk a little bit about that again, when you're paddling outrigger canoes out in the open ocean, sometimes you don't even see land. You're so far off. I've done that a bunch of times from between Molokai and Oahu. Like, sometimes you don't even see where the land is. And you have to navigate with your gut. It shows you where to go if you're in tune with it. And that's where the true self lies, the nerve endings and all that stuff in our intuition, in our heart area, our stomach area. And that's where we hope people can kind of live from. And of course, the mind is very important, obviously, but we want you to lead, instead of with the mind, sometimes want you to lead with your heart and your intuition. So that's a big part of like what we teach here in the classes.
And then what do the ceremonies look like? Who's running them? What's their background? How does that look when people are in ceremony? Like what's coming up, or I'd imagine a lot of people listening have sat with ayahuasca, but some haven't. So what is, specifically in Rythmia, what is that process like?
So it's really nice because we've been able to promote a lot of the plant medicine team from within. The head lead shamans that serve the medicine are highly trained. They come from the Ambawasi area of tribe of Punta Mayo, Colombia, and they've been trained down in that part of the Amazon basin. And they bring on Thursday nights the yahe, and yahe is the ayahuasca from that tribe. And it's considered in some circles, I don't know if it's viewed that way in all circles, but it's viewed as one of the original blends of ayahuasca. Because the difference is, as you know, in ayahuasca would be, they all have the vine, they all have the MAOI, but the DMT-rich plant is unique based on the regions. Like in Peru, and the Shipibos have their Mimosa tenuiflora and other things. And in Brazil, with the Santo Daime, they have a different sort of DMT plant, as well as Colombia with different chacruna and different things. So the yahe is Thursday night's medicine, but we make our own medicine Monday, Tuesday, Wednesday with this guy that trained with the Santo Daime. We don't do Santo Daime medicine, but he trained with them in the jungles of Brazil for decades. So he's like our cook, our ayahuasca shaman cook or chef, I guess. I don't know what the word would be. And so our lead shamans, we'll have a handful. We have about 5 of them. They take turns alternating different nights, and we give them a lot of time off because it's really hard work, as you know, to kind of provide this space for people and work with them. And they're all trained, and a lot of those guys come from traditions already that they were involved with. Like at the beginning of Rythmia, we had some Shipibo shamans, and then we had some Colombian shamans. Then we had some Santo Daime shamans. So we've kind of just learned in all these different traditions that have blended in with like our protocol at Rythmia with these intentions. So it's kind of like our own tradition in a way, like the way that Rythmia does it. It's kind of our own sort of mix of a lot of these things. And it's funny because sometimes we had this girl that was in accounting, and we offer the ayahuasca to our staff if they're interested. Most of them take us up on it, which is great. And she really connected with the medicine, and she had interest in working in the ayahuasca team. And so we slowly got her in there, and she was an assistant, a helper, and then she worked her way over 8 years to serve medicine. And she was really good. And we don't consider those people shamans per se. We consider them plant medicine providers. We only have a couple shamans that lead the ceremonies. But there's a lot of people, and there's 45 to 50 staff that are in there at night working with the guests. And we have a ratio of about 5 to 1, or sometimes 4 to 1 of guests to staff. So for every 4 or 5 guests, there's at least one staff member watching them and making sure they're okay. And the ceremonies start at 5:30, and we give people 3 choices or 3 chances to drink throughout the evening. So the first drink is around 6 o'clock, 6:15, and it's about a 2-ouncer, like a little shot glass. And it's, for most people, it's their first time ever drinking ayahuasca. So they're all nervous and worried and stuff. But we provide such a comfortable environment, and with a lot of eyes on them, they settle into it. They have their own mattress. Men are on one side of the maloca, women are on the other side. 7 bathrooms, all right there. Hammocks, a lot of grass. There's a fire. We have a laser perimeter that people don't know about. It goes all around the maloca. And if somebody breaks the perimeter, then a light goes off in the front desk, in the clinic, and in the maloca. Like, we got a runner. It doesn't happen too often. But we're very in tune with where everybody is, what's going on. About 2.5 hours into the ceremony, we asked for, do people want a second cup? And we tell people, if you hear it and you can get up, go get more. If you don't hear it or you can't get up, don't get more. And so maybe half will get up and get more. And they probably don't get maybe 2 ounces the second cup. Maybe they might. Maybe it's a 1 ounce. Just depends. The shamans check in with them Have you had visions? Have you been purging? Where are you at? And they kind of evaluate. And then there's a third offering, another 2.5 hours later and people drink that sometimes. Sometimes people skip one or two of those. Like everybody takes the first one. They might skip the second, go for the third. They might take all three. And that's how people can ease into the process and build confidence. And then they know how much medicine they might need for Tuesday night. And then the Tuesday night's the same sort of thing, the same exact protocol. But at the end of the ceremony, there's a closing group where the shaman just kind of, has a closing talk. It's around 1 a.m., 2 a.m.-ish. And then they go back to their rooms. We make sure they're safe. We got a lot of staff working all night, get them in their rooms. Sometimes people just stay in the Maloka and sleep there. And our paramedic is hanging around, taking vitals if people need it. Or, sometimes we took a guy down to the clinic yesterday because he processed a lot of trauma. He was a little scared, didn't want to go back to his room. So he slept in the clinic under supervision with the nursing staff. So there's just a lot of care that goes into, it's very intentional on how we do it. So each night's like that except for Thursday, which is the Yahe night. And the sunrise and the sunset are part of that tradition. So it's an all-night ceremony that goes until the morning. So that's a really interesting one that starts a little bit later, starts at 6:30, and it goes until about 8 or 9 in the morning. And that's the final one. And that's where they kind of have their breakthrough for a lot of them. Or, they maybe do new intentions if they've met all three already. So it's a really great, comprehensive approach.
If you enjoyed my recent interview with Dr. Nathan Bryan and the health effects of nitric oxide and are curious to work with this very interesting molecule, as listeners of the show, you receive 10% off all orders from their website using the code UNIVERSE at checkout. I really enjoyed my conversation with Dr. Bryan and his holistic approach to health, which really emphasizes not adding on or doing more things, but first focusing on the unhealthy habits that limit our own endogenous production of nitric oxide. So focusing on that first and then working to add some supplementation. I think he's doing really good work and is very much in alignment with my own philosophy. So check them out, and I will put a link to their website and the discount code UNIVERSE in the show notes.
And this is kind of a big question, but from your years of working at Rythmia, and then also because it seems like you're a voracious reader of literature, what would you say are the benefits of ayahuasca? I'm sure a lot of that has even evolved in the time you've been there, but what is ayahuasca for you? What are the benefits that you see, that you've felt, not only for yourself, but all the people that you've seen come through, and also what the literature seems to be pointing to?
So the literature is looking a lot at the health things that are remedied by ayahuasca. As a medical facility, obviously we can't make medical claims, but I can talk about, of course, what the guests report that they're having happen for them. So what I've looked at in the literature that matches what the guests are saying is that a lot of the autoimmune conditions are really improved or eradicated with ayahuasca. Ayahuasca is it's an anti-inflammatory, and so it really helps with disease and illness as well. Lyme's disease. We have the president of the Lyme's Association. He's from Southern Cal. He comes to Rythmia because he cured his Lyme's disease here, and he'd been on lots of protocols for years. And, probably that helped support the healing when he came here, but he got it out of his system completely. So he brings guys and men and women to us that have Lyme. So it's really great for that. It's also great for depression and the dopamine sort of issue. And there's theories about the dopamine, how it's related to depression. That gets recalibrated with people. So if I have low dopamine, maybe I inherited that trait, or I've environmentally been through things that deplete my dopamine reserves, I tend to be in a dysphoric or depressed place. So ayahuasca recalibrates those dopamine receptors and gets people feeling better. So it's really great for those mental health issues, anxiety as well, but real good for depression is what the literature is showing. Also with addiction, it's very interesting because we're not a drug or alcohol rehab, but we do have people that have an addiction history. They're not currently active addicts, but they maybe have a year's sobriety or more. And what they do, it's interesting because in the addiction world, there's kind of two approaches that are often battling each other out in the world of addiction. There's the medical side, then there's the therapeutic side. So the medical side says, you have a chemical dependency. You got to be on meds. You got to be on Suboxone. You got to be on, Ativan the rest of your life, whatever, because it's a medical issue. Then the therapists are like, well, it's a therapeutic issue because you're living a crazy lifestyle. You have bad friends influencing you. You have a triggering environment. We got to get you to be empowered individually. So those two things kind of often were at odds with each other out when I was in the world of addiction. But the beauty of ayahuasca is it addresses both of those issues. So it addresses the chemical dependency side by recalibrating the neurochemistry of the mind. And a lot of the literature is showing that. So if I'm craving alcohol because I have an addiction, once I drink ayahuasca, my dopamine and my serotonin and my norepinephrine and my cortisol, which have been the reason for my physical dependency because I need to surge those neurochemicals, that part gets handled with ayahuasca and gets reset. So then the physical cravings are not there after ayahuasca. But we all know that that's not enough because if you go back to a abusive relationship or a triggering environment or a job you hate, you'll probably end up drinking again. So you get the clarity, and I call it the ego-dystonic position, where you see the world in a different way. You see yourself in a different way. You see why you're doing these things, where they come from, the trauma that you held on to for years that you didn't know was there, or the discontent that's going through your life right now. So you get to have a therapeutic sort of hold on your stuff, and then you can move forward with both these, like a two-pronged approach to recovery. So I really like it for people that have that addiction history. So we've also seen people that had breast cancer and prostate cancer either stop the progression of it or completely eradicate it, which was mind-blowing to me because I never thought that would be possible. But we're seeing it. We had a girl here a couple weeks ago that her breast cancer went backwards in progression. And so, again, I'm not making a medical claim that ayahuasca will do that, but that's just been her experience. We also had a guy from Tennessee, a distiller. He's a funny dude, very cool. He had stage 4 liver failure, and he came to us about 2 years ago. And he's been to several times, and he's gotten all the way down to below 1. And there's no liver enzymes being shown that are problematic. There's not a high level of liver enzymes in his blood. And he's at Vanderbilt University this week, and they're just blown away. They're like, how the heck did you do this? Because oftentimes it's about diet at that stage, and of course not drinking alcohol and a bunch of other like meds. And he just didn't do any of that. He ate better, of course, but he drank ayahuasca multiple times throughout the last 2 years. And he's down to, almost 0 on the liver progression. So he's just like so happy. I mean, it's a miracle, to be honest. We also worked with people that have MS, and we had a girl come several years ago who was trying to work on, just accepting her diagnosis. She wasn't looking to heal her MS. She didn't think it was possible. Just kind of had to deal with it in a more productive way and not be so depressed about it. And when she went back to LA, she went to her normal appointment, and the lesions were almost all gone in the brain. And her doctor at Cedars-Sinai, we talked, and he was just like, what the heck is going on here? So now we have a relationship with Cedars, and they send us clients that have this. And, some of them eradicate it. Some of them diminish the symptoms. So there's a lot of medical stuff that we're seeing with ayahuasca in addition to the spiritual, the psychological, the emotional. I love all of it. And the beauty of the literature, in my opinion, is the epigenetic component that we're noticing. And epigenetics, in a nutshell, for your viewers, is the altering of certain genetic codes to be more beneficial for you. So if I have a genetic sequence that's problematic, maybe I inherited it, maybe it's a mutation, maybe it's environmental conditions have caused an issue, maybe I produced too much serotonin or something. I can methylate that gene sequence and histone coil it, which means it's not going to get transcribed and become messenger RNA as a reading tool. It's not going to be expressed. I'm going to block it from being transcribed. So then with that epigenetic thing that's based on intention, mindfulness, and meditation, which is mind-blowing in and of itself, the Sigmar-1 gene that we all have becomes activated with ayahuasca in particular, and that's where it connects the prefrontal cortex and the amygdala. So there's a whole biochemical thing going on that's all based around intention setting. And that's the part that blows my mind that the literature is starting to look at, because I never thought they would talk about, in the Journal of Scientific Health or, psychology journal, that they would look at, or biochemistry journal, they would look at intention setting. It's such a hard issue to kind of pin down in a scientific method, but there's a lot of articles coming out that show intention setting, mindfulness, and meditation on that intention create the methylization and the histone coiling in the DNA that activate the healing. So there's just so much happening right now. I can't even keep up with it, to be honest. There's a lot of articles coming out.
Where do you see Rythmia going? Is the goal to just kind of keep it stable, keep it running? Do you have ideas of growth, and maybe just also in a global sense? Like where do you see this medicine moving towards? Within the cultures we come from, within the world at large?
I was just in New York City, Midtown yesterday, speaking at a conference on longevity medicine and health that is the new frontier of sort of the medical field, which is plasmid and viral vector and stem cell sort of therapies, not just for longevity, but also for healing certain certain issues that people have in their, whether it's Alzheimer's or dementia or autism. We're looking at different stem cell protocols and different anti-aging longevity things that are helpful for people that are not necessarily FDA approved at this moment. And my talk was on plant medicine as a longevity protocol, because if you are not afraid to die because you've lived a way that you now understand yourself, if you're not afraid to die, you're not afraid to live. And it helps enhance your lifestyle when you don't hold trauma and when you've resolved things. You don't have, as I call it, you're not flooded with emotional baggage. You've released it. So I explained in my talk how longevity protocols that involve psilocybin, ayahuasca, and other plant medicines are really helping people live fuller, happier lives. Because with this longevity push that's out in the world, and it's kind of weird sometimes, like people just think, well, I don't want to live forever. It's not what it's about. It's about living a quality life for the years that you are alive. And the plant medicine really fits into that as a way of being happy during that. Because if you're 100 years old and you're miserable, well, why live to 100? But you want to be happy. And so this part of the plant medicine sort of role in that is important. So I lecture a lot on that topic, and also I talk to therapists about and counselors about how to use a process called projective identification and a corrective emotional experience with clients. And that's a Freudian Model 3 object relations protocol that involves people that are empaths. And I talk about how to work with that. So that's something that I use out in the field to kind of help therapists not get burned out and not tank and quit their jobs. Like masters in social work are often people that are very empathic because they're working with low income, underserved inner city stuff. And it's really tough client population. And they last in the field about 3 to 5 years, then they quit. So I go and I teach those counselors how to not let that happen, how to absorb energy, understand it, redirect it, as opposed to hold it. Because a lot of therapists, I thought this too, they think that your job is to try to make everybody feel better. And, that's the end goal, I guess, but it's not your job to hold their pain. And so a lot of therapists didn't learn that in school. So I help teach that. So within that framework, there's been because of our medical license, we've drawn a lot of attention. And governing agencies from different countries around the globe have recruited us to bring arrhythmia to that part of the world. And so we're looking at 3 places right now out in the world that potentially we could go to. And they're very favorable to what we're doing because of our licensing background. And I've been, working with different governments. There's different countries that are pushing new legislation that I'm helping earmark for plant-based remedies, because I have seen the benefits of ayahuasca, psilocybin, iboga, now with the executive order to have ibogaine being used on the veteran population, and also opiate addiction. It's very good. So I think Rythmia is going to expand into other places that are ready to have a true healing modality that they can measure and can help their population. The U.S., though, is tough because of the lobbying efforts of pharmaceuticals, as we know, and just the size, of the U.S. and the red tape. But there's hope, especially with this executive order on ibogaine, which I'm a huge fan of. But it has to be done in the right way, because all the shamans, and of course myself, I'm not a shaman, but they're all worried that as this becomes more mainstream, it's going to lose the spirit of it. And I do believe that's a risk. So I think it's our job to make sure that doesn't happen, but at the same time, make sure we can go into open the doors that allow this to be something that people can access.
Feel free to not answer, but are you able to say where that extension of Rythmia may happen? Because I think that's interesting, even just thinking like what countries you would be thinking of that are open to that, because I think that's quite an interesting paradigm shift as well.
Yeah, I would love to say where these countries are, but I had to sign NDAs at this time just because we're in that process with them right now. Those governments have required me to sign an NDA, so I can't talk about it yet, but it's coming really soon. In this year, 2026, I'll be able to explain where we're going next. It's really mind-blowing where these places are. You would never think they in a million years would want it, but it's really cool. It's going to happen soon.
Middle East?
Could be.
I wanted to ask you, interestingly, more about the executive order that was just signed, because obviously it's something that has just happened before we're recording this. And as you said, the U.S. is an interesting place in that, on the one hand, it is very free. It is still, I think, the land of opportunity. And yet there is a history of suppression of plants, of certain practices. There is certainly a model that's favorable and even in legal terms that you have to follow. It's always so interesting because we also live, I think, sadly, in a very politicized time where people just take teams, and team 1 is good, team 2 is bad, and not even being able to acknowledge the good things that can happen from maybe a group we don't necessarily agree with. But that is what it is. But what do you think? And you alluded to some of this already, but. And maybe even if you want, just to kind of, if you could summarize what was just passed specifically with ibogaine, and how do you see that going? Why do you think that is good? I mean, I think it's interesting, and I would agree in an ultimate sense it is good. Why do you think that's good? And then maybe if you can speak more about the downside of that, because I think that's also something that even a lot of people in this movement, they think any form of legalization is good, but as you said, there's some important issues, which is it's still putting it in the hands of a very particular group and potentially isolating the very origins of where these medicines come from.
Absolutely. So with ibogaine in particular, the iboga plant has 13 alkaloids or active ingredients, and one of them is ibogaine. And that's the one that's more specific for opiate addiction. And also it works really well with trauma. But the other alkaloids are more psychospiritual oriented. They're more of a journey. The other alkaloids allow more of this spiritual experience. And so the purists, the Bawidi tribe from Gabon, Africa, they stick to the full plant. And it's a really powerful experience. I'm sure you've talked about this with your listeners in different podcasts, that it can be a 12 to 36 hour experience that's really deep. And I've had my own experiences with Iboga, the full plant, lots of times that were very profound. And the medical side of Iboga and Ibogaine, and there are clinics, as you know, in Mexico and other parts of the world that they allow this, and it's very, very medical. And you're hooked up to heart rate monitors and IVs, because Ibogaine alone, as the isolated alkaloid, is extremely powerful. And you do need 24/7 medical supervision, because what's happening with the opiate receptors, when someone has an opiate addiction, heroin addiction, pill addiction, we all have opiate receptors that are natural for our own pain management. And if I flood my body with opiates, synthetic opiate or heroin, my opiate receptors fold away, because my body is constantly trying to live in a space of homeostasis or balance. So if there's too much opiate in my bloodstream, I don't need as many opiate receptors. I fold them away. And that's why you need more and more of the opiate over time to hit the few remaining opiate receptors that are still extended out. So when someone tries to go sober from opiates, the opiate's not in their bloodstream, but there's no opiate receptors, or very few, and they have to come out and regenerate, and that takes up to 18 months for people. Most of them happen within 2 weeks, but that 2-week period is brutal, and that's the withdrawal period that everybody's afraid of. So with Ibogaine, it immediately kicks out those opiate receptors within 24 hours, and then the withdrawal is gone. Now, as I've talked a little bit about earlier here, that's great. But if I'm a heroin addict and I used heroin right up until going to my Ibogaine treatment, what are the chances really of me staying sober? Pretty slim, because I would have to make so many changes back in my life. If I'm a heroin addict, I probably don't have a job. I probably burned all my bridges. My family's probably upset with me. I probably don't have any money. So there has to be more than just that treatment. There has to be a whole system for that person to thrive and to kind of make those changes. So my issue with the Ibogaine legislation, the only real, I guess, issue is that it's not a magic pill. None of these plant medicines are. They're a starting point. And if someone, in America, we think, not us, hopefully, but we think in just the population that I want results now. And I want to, if this is something I do, I want to see the benefit. I want it to just be one and done. I'll move on. And that's just not the case for these protocols. Now, is there exceptions? Of course. There's some people that had one ayahuasca ceremony, turned their life around. They're amazing. But I've never seen it. I mean, I'm sure it's out there, but it does require a whole set of supportive things afterwards. And so if a pharmaceutical, it's kind of like the cannabis model I look at a lot that happened in the US. Cannabis, as we know, has so many great benefits: seizures, tuberculosis, glaucoma, cancer, pain management, all kinds of stuff. And then just recreational connection and relaxing. But because it's become this industry that's become so economically viable, and these big companies have taken it over, the type of cannabis being groomed and being cultivated is so ridiculously strong that it loses, for a lot of people, that connection part, and it just flattens them out. And a lot of kids we're seeing are getting addicted to cannabis in a way that was never happening before. When people used to tell me at passages, like parents would call me and say, I got to get my son in there. I'm like, okay, well, what's his drug of choice? Cannabis. I'd be like, what, really? Like you're going to spend all this money for cannabis treatment? I was kind of like, talk them out of it, But nowadays, they should go, because the weed is so strong and so potent. And I feel that it's lost a lot of its spiritual components and self-evaluation components. And now it's just about becoming numb. So the pendulum kind of swung way far the other way. So my fear with Ibogaine, with psilocybin, that's become legal in a lot of states, which is also great. And with also these heart-opening psychedelics like MDMA, those are great too, but it's all within the context of treatment. We know that in the 60s, during the Vietnam War protests, the government was really upset at all the people protesting, and they saw that the profile of a protester was a psychedelic person taking mushrooms and drinking, alcohol, maybe but doing weed and all this stuff. So they suppressed the psychedelic movement and put everything on a Schedule 1. And so that's the Geneva Convention of the early 70s that made all this stuff illegal because the government didn't want people to battle them and try to overcome like their policies. So all this stuff got demonized, and the MDMA in particular was being used, as we know, in couples therapy originally, and then it trickled out into the club scene and became a drug that was abused by a lot of people and became dangerous with the methamphetamine binder. So now what's happening is this stuff is starting to kind of come back out in a more intentional way. There's a lot of great agencies out there, ICE, Sears, MAPS, all these big international groups. They're trying to help this kind of go the right way. So I think it's very important not to lose that spiritual side. And I guess that's always going to be the challenge, like with this ibogaine legislation and with the psilocybin legislation that's passed in Oregon, Colorado, different parts of the country. And my fear is that it will become something that's just another one of these things that doesn't really long-term help people. You got to have a system surrounding it. That's at least what I've seen is a key component.
Yeah. And then also, as we maybe begin to wrap, you alluded to this and spoke a little bit about it. But as someone who has a background in the psychiatric field, I think you very wisely said that often a lot of people in that field do carry a lot, and maybe not as intense as a veteran, but they're still working with trauma. They're still experiencing other people's trauma. They're often going into very dark places themselves, and there does tend to be a certain detachment from that. But unless you're highly skilled, there's going to be some sort of absorption. Have you seen benefit with people in those fields with psychedelics like ayahuasca in being able to help them, whether they realize it or not? Because as you said, a lot of times maybe someone in that field comes, as you said, the one example of, well, my client is experiencing all these benefits, so I just want to see what they're experiencing. But for themselves, what begins to emerge?
So what happens with the clinicians is that, like I've alluded to a little bit in this podcast, is that they're absorbing the projective energy from their client, and that can be addiction, that can be trauma, that can be anxiety, whatever. It can even be psychiatric mental illness. They're absorbing it because in that therapeutic moment, the therapist wants to connect with the client. And the therapist wants to feel what the client is going through as best as they can, because obviously the therapist is not the client. But if a therapist is empathic and has empathy, which they all do, pretty much 99% of them do, they're holding this emotion in a session. And then the clinician feels sad. And it would be logical to think, if I'm feeling sad, I must be sad. And then their mind wanders in session and they think, oh yeah, I miss my daughter. She's all the way to college. Oh, I hope I call her tonight. And then they get bombarded with this stuff. So and they lose focus of the client's sadness. So the protocol with a clinician is to recognize that sadness, that it's not yours. And in order to recognize it before that session even starts, you have to plug in and connect to yourself. You have to, like I used to do this when I learned about this before a session. I would sit in my office and 5 minutes they're coming in and I'd say, okay, how am I feeling? Where am I at? Am I hungry? Am I angry? Am I happy? Am I excited? Where am I at? It takes 2 minutes or less. The client comes in, I unplug from my own self and I open up like an empathic therapist. I invite the projection. I hold it and I go, oh, okay, we got some anxiety. I'm feeling really worried and anxious. Okay, I know that's not me, it's my client. Then you talk about it. Are you feeling anxious today? What's going on? As a matter of fact, yes, I have a job interview tonight. I don't know what to do. Oh, okay. So then you go back and forth. And this is the part I mentioned of the projective identification onto me. And I do what's called a corrective emotional experience back to them. And this is something called the objective third that gets created in the therapist's room. So the people that don't know, the therapists that don't know that they're just holding, they're just doing the first part. They're not redirecting. They just absorb, feel, understand, but then they don't give it back to the client. They let the client leave feeling great and not burdened. And they say, I love you. You're the best therapist ever. But the therapist is holding the bag. And then a whole career of doing that gets to that part where they're flooded. And those are when the clinicians, aside from the ones that they just got fired from their clients, these are the ones that come to us. And they have open, great hearts. They're all empaths. They love people. They love their career, but they've got burned out. They're just done. They're flooded. And so they drink ayahuasca. The medicine is trying to get to the core self, but it has to go through all this baggage first of all this emotion you've been holding for everybody else since you were, became a therapist. And oftentimes that kick started off as a kid, because when you're a kid and you have trauma and your caregivers aren't meeting your emotional developmental needs, you got to use some sort of tool to navigate your world so that you do this as well for survival. You unplug, pull in the emotions of your drunk, violent dad, and he's fine, so I can navigate around him. And I'm feeling where to navigate. I'm only 5, but I'm very good at assessing. So a lot of therapists come from that sort of background where they had to use this tool to navigate their world to be safe. And they naturally go into therapy, become psychologists or masters in social work or MFTs, and they're really good at it. They're amazing, but they've been holding all this stuff since they were a kid. And so the ayahuasca ceremony for those people, the very first one, is chaotic and it doesn't make any sense. And it's just these weird images or thoughts. And it's like, what is this? This isn't relevant to me at all. Or they might have a nada, which is just nothing happens. And then if that's the case, I talk to them and I point all this out and I explain to them potentially what's going on. And so then I say, okay, show me who I've become. I go back to our intentions and I tell them, okay, you've become everything you've been holding from your clients. You've become anxious, suicidal, craving alcohol. You've become all these things. Those are the clients you're working with. That's who you've become. It's like, oh, okay, makes sense. Now merge. You can merge back with your true self. Well, that nobody wants to do that. That's an empath, because if you're connected in that moment, you're not hypervigilant. In that moment, you're plugged into you. And that's a scary place for an empath, because you can't read the room when you're connected to yourself, because you're just present with you. You're not absorbing people's energy when you're connected. So there's a resistance to being plugged in to the person that's the therapist or the counselor. And oftentimes we all make jokes. Therapists are all crazy at some point. They become nuts. And that's because they're holding on to all their clients' emotional baggage. So if you can talk yourself through the resistance of connecting, and that's a really simple process. You say, I'm safe, I'm here. The conditions that caused this sort of hypervigilant sort of way to live are not present. My drunk, violent dad is not in the Maloka. I'm not being, I'm not in therapy holding everybody's pain. I'm just with myself and I'm safe. And I already know who's here at Rythmia. I already know the guests, the staff. It's cool. So they plug into themselves. They talk themselves through it. They maybe pat their chest, breathe, they feel their breath. And that's where they connect, because the natural human space is connected. It's not in a fight or flight response 24/7. And that's the space that they're in. So they help them connect. And in that connection, the healing occurs. And the healing for the therapist and for the counselor and for them is telling themselves who they really are. Because if this started for them, for the therapist when they were kids, what does a 5-year-old think if their caregivers are not meeting their needs? The 5-year-old kid doesn't say, my dad needs a sponsor. Or my mom, she's borderline and she's crushing oxys and snorting them. No, the kid doesn't understand. The kid thinks something's wrong with me. I'm broken. I don't deserve their love and attention. So that's the wounding that kickstarts this empathic process as a tool to be safe. So the third intention for the therapist is looked at a little differently. You tell yourself who you really are. Who are you? You're a blessing to people around you. You're a loving, wonderful, perfect human. There's joy that you bring. There's light that comes off your body. You're a wonderful person that this world needs more than anything. And that's where the healing starts to kick off and you connect with your true self. So that process is a big part of what our clinical guests go through. And then I teach a second part to that because people say, well, if I get flooded naturally, that's my sort of my way. How do I not get flooded again as soon as I leave here? And so I teach them how to do that. But it's a really big deal for therapists and counselors of all type to be able to understand that dynamic.
And that idea of not getting flooded after, it's similar to that practice that you described of just kind of consciously before and after separating from the client and who I am, tuning into to how you are.
Yeah, there's the projective target. So the therapist who's the projective target has to understand that they have 4 traits that are green lighting people to project onto them. They're often unaware of these 4 traits. The first 3 traits are great. They don't want to change this. They're loving. They're a caregiver. They're perceived as emotionally stable. They might not feel emotionally stable, but they're perceived as such. Those are great things to be, and don't change that. But the 4th one is what green lights people to project and dump on you. The boundaries that the therapist has with themselves is unclear to them. And what that means, that's a weird statement, but what does it mean to have boundaries with myself? What it means is, how much of my own emotional energy am I willing to invest in someone else to meet their needs? And so the way I explain this to the clinician is I say, okay, in your practice, you have a lot of different types of people. When I was at the psych hospital doing rounds, I would see a client that was highly schizophrenic. The goals of therapy were hygiene, put on your clothes, brush your teeth. That was the goal of therapy. Whereas I'm meeting with another dude 2 hours later, outpatient. He's an attorney. He president of his country club, going through a little marital issue. So the therapeutic goal is very different. And I'm aware of the amount of emotional investment I need to make in each person. It's not level of how much I care. It's not level of how much I love my kids or my family and that dynamic. It's a matter of how much do I need to meet their needs. And I don't need to meet their needs the same way for everybody. The other example I give are my kids. I have a 2-year-old and I have a 26-year-old. So my 26-year-old, she's in law school at Texas A&M. She's very empowered. She's great. She's doing awesome. And I don't flood her with my emotional energy to meet her needs. My 2-year-old, she's a baby. So she needs a lot of my emotion. She needs as much emotional energy as I can give her because that's the stage she's in. So I know the difference. I know how much to give and how much to not to pull back and to hold. And that's all it takes to have the boundaries with yourself. You have to know how much are you willing to invest in someone else to meet their needs. And if you're not sure and you're a loving, caregiving, emotionally stable person, perceived that way, and you don't know where this is, you're going to get targeted and you're going to get dumped on. And people with personality disorders, or as I say, so-called personality disorders, they're going to target you, and you're going to be the most popular therapist in the world, but you're going to end up in the psych unit yourself eventually, you know?
Yeah, I think that's a really beautiful way of putting it. Maybe kind of final question, as you brought it up, and it was something I wanted to ask you anyway, so it's a good way, is that idea of kids. It's interesting because, maybe not as much in your line of work, but it is a very common archetype I see in this work with plants and medicine and people who are starting to go into it more deeply is, I think, like potentially any field, but maybe even more so with this field, is there's always this this desire to do more. I need another ceremony. I need another medicine. I need another plant. I need another dieta. I need something else. And there can become a point where the family life ends up never happening because there's always something else to strive for. I think people who have children, they bring a different wisdom, a different energy to this work that I think is very important. What is, and it's a huge question. There's maybe no specific answer, but what has that been like for you of having kids? How has that kind of affected your work in your field, and specifically with plant medicine, because it's a very interesting field and a very new field for a lot of us. So, I think there's a lot of kind of issues and questions that can arise, but at the end, I think it's such a beautiful thing. And that you have 5 kids, I think is amazing, and also quite unique for maybe someone in your role.
Yes. For me, having the kids has enabled me to be forced to balance my life in a productive manner, because I'm a workaholic by nature. I study. When I was in school, I just would live in the library, live in classes. I was rarely home, and that was unbalanced, and I was unhappy, actually. And having kids requires you, as a clinician or as anybody, any parent would, you have to be balanced and to provide the care that your kids need. Now, the difference between my patients and my kids, obviously, is that I'm not the parent of my clients, even though they might look at me like that sometimes, because I'm a figure of, I guess, support and connection. Like, kids view us like that too as parents. But for me, the key to having the way I was able to be a good dad, and again, I've got lots of flaws, of course, lots of things I'm always working on, but it helped me realize that each of my kids are individuals that are on their own path. And my goal with kids and with clients, with patients of mine, is to provide a supportive environment and point them in the right direction. And then it's up to them. And along the way, I'm nurturing and supporting, but I'm not telling them what to do. I'm not making them do something that's against their sort of what they want to become. Now, obviously, when they're under the age of 18, there's a lot of things that you kind of maybe have to really be more firm on. But at the same time, you have to honor the individual person and what they're like. All my 5 kids are very different, like totally different than each other. And all my patients, totally different, very unique individuals. Everybody that comes to Rythmia has just got an awesome story. And all my clients back in LA were just these incredible people, whether they're in the psych unit or in the rehab or in my private practice. I really appreciated all of them. And I think my motto with kids and with clients is, I am who I am as a person because of them. Because if I'm truly absorbing their energy and understanding them and then redirecting it in a way that's beneficial, I've changed as well as they. And so I'm not an island isolated by just Jeff. I'm somebody that's been adjusted and influenced and coordinated with by my family, by my kids, and by my clients. So I owe everything to my children, my wife, and my patients. And it's helped me evolve. And I think having that mindset that, like in therapy, like, I'm the expert, I'm the smart one, I'm the doctor, that doesn't get you very far. That doesn't really work in a clinical environment. You have to be open to being surprised, because people say, well, I've seen it all, I've done it all. That's not true. Like, there's always something new. There's always something unique happening. And I think the kids put you on your toes for that. And because the kids are like, they're part of you and you see yourself in them. And it's just a beautiful process that helps you grow, So I couldn't wish a different life for me in a million years. I just love what I'm doing with the kids. And it is a unique thing to have 5 kids as a psychologist, My fear was always, because my oldest daughter and my oldest son, they would say, "You're being a psychologist again, Dad, just be Dad." And so it's hard sometimes to transition back and forth between the clinician, the dad. But I've been able to find that balance through my kids' sort of redirection of me. So it's been very good.
Oh, beautiful. Well, Jeff, this has been an amazing interview. It's really exceeded all my expectations. Is there anything that we didn't touch on that you want to touch on? I mean, we've gone more than 2 hours. I think we could talk for another two easy, but maybe one day we'll do round two. But is there anything else that we didn't touch on that's on your mind that you'd like to speak about?
I think we hit all the main stuff, man. I mean, it was great. I think we hit all the that's the stuff I usually think about, and I'm dealing with it here at Rythmia. I think you did a great job. I love the questions you brought.
Oh, well, thanks. I appreciate that. If people are interested to reach out to you, to learn more about you, Rythmia, what's the best way they can do that?
There's a couple different ways. They can just go to Google and type in Rythmia, and up will come Rythmia Life Advancement Center in Costa Rica. You click on that. There's an 800 number. There's also a form you can fill out online. Or if you go to our Facebook page, Rythmia, or Instagram. We also have TikTok, all the normal social media stuff. You can log in and see what we're about. You can see our workshops that we have and our guest speakers. And if you can't afford it, then you can fill out a scholarship application, and you will eventually get here. Just got to be patient sometimes, but we want to get you here if you qualify medically. So those are all the ways to get us. There's a lot of content online. YouTube has a lot of videos of Rythmia and sort of background information you can dive into and investigate.
Amazing. I think that's amazing that you're doing those scholarship opportunities, and I really enjoy talking to you. I think you're a great voice. You're very grounded. You have a side in the medical field. You have a side in the experiential field, the spiritual field. So I think you're a really good voice for this work. And thank you for what you're doing on a personal level, on a societal level. I think more people like you are needed, especially as this work goes out into the public. So thank you very much for your time, for all you're doing. And I hope we keep in touch. Maybe our paths will cross one day. And I really just wish you all the best.
Absolutely. Thank you so much for having me. I loved speaking with you, and I'd love to do this again in the future. Absolutely.
All right, everyone. That's it. I hope you enjoyed that conversation. As I said in the interview, it really exceeded my expectation. I think he really speaks from a very grounded and just deep place of his own experiential wisdom. So thank you to him for coming on. Thank you all for tuning in. As always, if you're interested in working with myself, you can check out my website, which is nicotianarustica.org. There'll be a link to that in the show notes, with our plant medicine retreats, working via the medium of tobacco and tree medicines. There's some really beautiful offerings we have. If you're interested in integration work, consultation work with me, all of that is there. If you are able to support this podcast, that's always a really big help. Patreon is probably the best way to do that. You can sign up for as little as $1 a month. There's different tiers you can sign up for. And also those tiers give you a lot of really interesting things back, early access to shows, a lot of bonus material now, Q&As. As always, thank you so much to the people supporting that way. It really means a lot. And if you're able to, thank you so much in advance. And as always, just helping with the algorithms is a really big help. So if you're viewing this on YouTube, hitting the subscribe button, turning on the notification bell, liking the video, and if you're listening to this on Apple Podcast or Spotify, leaving a starred rating and a short review. So that's it. I hope this finds you all well. Thank you as always for tuning in, and I will see you all in the next episode.
Tung